We are doing a breast conservative surgery for a 5 centimeter 5 into 4 centimeter lump in outer quadrant of the left breast. Here you can see the tumor measured around 5 into 4 centimeter in the upper outer quadrant of left breast, and we are planning for a wide local excision, that is breast conservative surgery, followed by LICAP flap reconstruction and axillary lymph node dissection. Here we are excising the tumor with adequate margin around 1 centimeter around the tumor. Here we have adequately mobilized all the parts of the tumor, and we are excising the base of the tumor. We have gone right up to the pectoralis major fascia, and we are excising the base now. It is good to mark the tumor before full excision, so that the dimensions as well as the site of marking is sent for final histopathological examination. And so post excision, this is the tumor specimen. After this we can see that we have got a 5 into 4 centimeter defect in the tumor in the breast. So we are planning to reconstruct the defect with LICAP flap. The base of the tumor was marked with LICAP clips, so that it helps in adjuvant radiation post-operatively. So here we have seen we have raised the flap from the posteriorly from the serratus latissimus dorsi muscle and posteriorly from the serratus anterior muscle there, and we can see it is based on lateral intercostal artery, which will demonstrate later. Here we are transposing the flap into the breast defect, and which will cover the breast defect. So we have transposed the flap into the defect in the breast, and this will give a good cosmesis of the breast with adequate to filling of the breast as volume as well as cosmesis. Here we can see the lateral intercostal artery based on LICAP flap. So following this, we have done the axillary lymph node dissection. Here we can see the intercostal brachial nerve was preserved. Here we can see the serratus and serratus anterior medially as well as LD laterally, and we have done a level 1 and 2 axillary lymph node dissection adequately following excision. This is the final cosmesis post surgery.